So one of the ways to find the coccygeus muscle is to go down to the tip of the coccyx and then go off to the side. And there's a little tiny slip of coccygeus right there, and then most of it is under the sacrospinous ligament. So I'm going to walk down the coccyx and follow it to the end, and then I'm going to go off to the side. And there I'm on it, and if I curl up and in, I'm getting it right underneath the sacrospinous ligament. And I'm going to switch hands for the camera. So I'm going up and under this. And now I'm angling in to this angle between the coccyx and all the ligamentous tissue. And then I'm also doing right along the side of the coccyx right there, angling down in that way. That's for coccygeus. And if you can't find the point of the coccyx, then you know it's really way too curled under. And that will probably require internal work to fix that. And so she is nice and straight, and I'm going to go on either side of the coccyx and then scoop up towards the sacrospinous ligament and check the sulcus on either side. And she is a little bit deeper on the sulcus on her left than on the right. So I know that she's tighter on her right. So I will treat the right side. Is that all right, Judith? So I'm actually hooking my fingers up and under the sacrospinous ligament to go under to get to the rest of the coccygeus. Is that higher than a 3?
No, not yet.
Am I on your edge?
Close.
Okay. And it's okay to go lighter longer and wait till the tissue softens, and right now it's beginning to soften. And you'll notice I have no fingernails. That's so that I have more options for treating my patients much more comfortably. And there's another little spot right there.
It's a little tender on the more lateral.
It feels a little thicker over there to me too, right there.
Yeah.
And it's helpful if you can keep your wrist straight and your fingers straight as you're working in here. And push more from the upper arm than actually from moving the wrist around. It feels more comfortable to the patient. And there she goes. Do you feel that?
Yes, I do. Open.
Can you feel the part I'm on now?
I can feel it, but it's just a bony edge. It feels like a bone.
It's actually muscle. But I'm using the ligament as a pressure point on the backside. Finish the work. There you go. That's wonderful. This can be really useful to do before doing internal work. One, so the patient gets used to you having your hands on their pelvis, and it also just makes less work to do once you go internally. If you're sticking to external, that's perfectly fine too. And then just make sure both sides are even. Very essential around the coccyx that both sides feel the same to the patient before you leave. And this can help sometimes with posture, sitting tolerance, and walking. Okay, and I'm scooped up underneath the sacrospinous ligament just on the other side. And nope, that's definitely more room on the other side.